Hi, everybody. My name is Josh Green, and welcome to the Menopause podcast. I'm going to be interviewing my sister today, and we're going to be talking everything about the menopause. She happens to be a doctor here in the UK, and she runs a menopause clinic. So, welcome to the DXE Menopause podcast. Sis, here we are again, episode 2. Episode
Amazing.
1 went amazing. Now we're on episode 2. That's what we like to rumble in the Green household. So
yeah, we're rocking it.
Yeah, we're rocking it, exactly. Right. So on the last episode, we were talking about symptoms, and we were talking about kind of a general overview of the menopause. So friends, if you want to go back and listen to episode 1, very informative. On this episode, I think we wanted to investigate treatments, really, and just a kind of a high level, what's out there from a treatment perspective.
Mm-hmm. Okay.
Yeah. So what is out there, and is it very kind of what's the word? Is there one treatment for all, or is there kind of a way to kind of target a treatment for, depending on the symptoms of the patient, of the woman? How does that work, and how does it go from a doctor's perspective? How do you kind of work out which treatment is? There's a lot of questions in this question, by the way. How to work out what the best treatment is? Is it very I'm just interested. So how does that work?
Yes, so there are a lot of different treatments out there, and I suppose firstly it depends on what the woman wants, what they feel most comfortable with, and the second thing is also what range of symptoms is the woman suffering with. So some women might be very lucky, and from one day to the next the period stop, they don't have any symptoms, very lucky. Some women might have all of them, they might be going through an absolutely terrible time. Some women might just be having hot flushes that they want to control. So it all depends on the symptom and how the woman wants to proceed, really, because there are a lot of different options.
Can I just, before we get to the treatment, I'm just interested on, you mentioned about we talked about on the last episode the symptoms. So just quickly, so there is it the fact as well during that whole period of the menopause that could you experience all the symptoms, just some of the symptoms, or is it very kind of specific? So at a certain point you could be having hot flushes, they go away, then you could be having some urinary tract problems. Is that the way it kind of works as well? And obviously then treatments would be targeted depending on where you were on that journey then, wouldn't it?
Yeah, exactly. So you what kind of treatment might be suitable for you might change at different times of perimenopause or the menopause, and any combination of symptoms is possible, and that can change from one day to the next as well. So yeah, you might just have hot flushes. I say just, they can be quite debilitating. You might just suffer with low mood, you might just suffer with headaches. Sometimes in the early stages, you might notice perhaps you're getting more headaches around the time of your period. And then when you look back, you realise actually that was the beginning of things changing. And then over the years, perhaps, or the months, then things change again. So yeah, any combination is possible.
Okay, so treatments then. So let's talk about treatments.
Yeah, so the first thing that is essential is lifestyle. So that is absolutely the most important thing that needs to be there as a base for any other treatment, really.
Okay.
I say that also, though, whilst recognising that sometimes it can be very difficult to make changes to your lifestyle if you're feeling rotten hormonally. So if you've got no motivation, if you're tired all the time, then it is going to be very, very difficult to make changes to your lifestyle that are going to make you feel better. And so sometimes kind of working on your hormones, first of all, can be a good kind of passport to then you being able to make changes to your lifestyle that are going to get you feeling even better.
Okay.
But fundamentally, lifestyle is so important.
So let's talk about lifestyle then. Let's unpack, as they would say in kind of a podcast now, but let's unpack that. What does that mean when you say about lifestyle? What elements of lifestyle are impacting? Is it diet? And I'm just thinking, is it diet? Is it exercise? Those are the classic ones. Or are there any other elements of lifestyle that maybe women can work? Well, people can work on, but women specifically.
Yeah. So both of those are more, and I guess, and I'll go into those. The main thing. The main reason that lifestyle is so important is, first of all, because it can help with your symptoms.
Okay.
Flushes, for example, can be helped by exercise. We know that from the research that tells us that in some women, your hot flushes can be reduced by exercise. But the other important thing here is that at the menopause, we're not just thinking about the symptoms that you're getting, but it is also marking a bit of a transition of how much you need to work on your health to keep yourself healthy. After the menopause, your metabolism changes. It can be easier to put weight on around your middle, which we know isn't very good for your heart and things. We know that it's easier for your body to deposit the cholesterol on the lining of your arteries. And so this is a real opportunity going through the menopause to stop and take stock and think, actually, I really need to look after myself now, because my body really, really needs it. So yeah, lifestyle is important for that, but also because it can help with the symptoms. So diet, first of all, really, really important.
Okay.
Mainly because, I mean, you need to be making sure you're getting all of the right nutrients. Because when your hormones are changing, when you're going through the menopause, your body is a bit more sensitive to how you treat it. And when we're in our maybe 20s, 30s, our hormones are working optimally, then we can kind of afford to do those excesses and they don't really affect us that much. But when our hormones are changing, our bodies are a lot more sensitive to it. So having too much sugar will send your sugar cravings going up and down, your blood sugars going up and down. Being often, you may be less tolerant to it. It may increase palpitations and anxiety.
Yeah.
Alcohol, you may deal with it less efficiently. You don't metabolize it as well, and so you feel unwell or more tired after drinking. And so trying to reduce the amount of sugar, caffeine, alcohol is quite important. Exercise, as I've already mentioned, it can reduce hot flushes. We know that, but that is also key to improve cardiovascular health as well for the future.
Yeah.
And not just that, but also after the menopause, your muscle mass will decrease. And when your muscle mass decreases,
Right.
your metabolism slows down.
Yeah.
So as well as doing cardiovascular exercise, it's really important to be doing work with light weights as well. So some work with weights is really important, and that will also increase your bone strength, which is really key around the time of menopause.
Yeah. I was listening to something actually on that about about using weights and making because like you said, after the menopause, well, it's not just about that period that like you said, you notice a change, doesn't it? But afterwards the body has changed, doesn't it? And it's a question of keeping on top of and doing some exercise and doing the weights. And I believe weights, because it's grip as well, isn't it? And making sure you're keeping your grip strong, etc., etc. So that's interesting.
Yeah. Keeping your muscles, keeping your muscle mass, and keeping your strength and working on your bone strength is really important. And obviously the mental health benefits as well that come with doing exercise. While we mention bones, a really, really important thing to do, and we should all be taking vitamin D supplements.
Yeah, I do.
Brilliant,
Yeah,
brilliant. Yeah.
yeah,
And we should all do, especially living in the UK. We don't get enough sunshine, we don't get enough vitamin D.
yeah.
And actually, whenever I test anybody's vitamin D levels, I'm always surprised if they're normal.
And that's UK specific, but also there's northern. I mean, we're on the worldwide podcast here, so there's Northern Europeans. I guess I'm not sure about Southern Europe, because obviously there's more sunshine there. But generally speaking, like you said, people, if you certainly if you're living in less sunnier climes, let's say, vitamin D for sure. And you see that as well, then, do you? When you test patients, generally speaking, patients in the UK are generally low. So I think the UK Health Authority actually talks about, and maybe other European countries do the same in the north of Europe as well, talk about that as well. So yeah, interesting.
Yeah. So we all need vitamin D supplements. Really important building blocks for the bones, and alongside that is calcium as
Right.
well. But calcium from the diet, really, if you can
Mm.
get the right amount of calcium from your diet, it's better than taking a tablet when we talk about calcium.
Mm.
It is surprisingly difficult to get enough calcium in your diet, because around the time of the menopause, your calcium requirements really shoot up.
Oh,
And
do they?
it's quite difficult actually to eat enough dairy and other foods that contain it. So you have to be quite conscious of it and really work on it. Um,
Mm.
there are some websites out there that tell you how to calculate your calcium intake. But
Mm.
calcium, vitamin D, hugely important for keeping your bones strong.
Right. Okay. Okay. Cool. And so, what are the lifestyles? So we've talked about exercise. We've talked about diet. What other lifestyles? Are any other lifestyle things that we need to think about or change or be focused on?
Those are the main ones really, but I suppose as well thinking about stress
Oh
levels.
yeah. Yeah,
Um,
stress and maybe sleep as well, isn't it? Sleep, because that's always a difficult one as well. Sleep, because I guess with hot flushes and various other of the symptoms, sometimes that can be that that. But I'm not sure how you deal with the sleep side of things as well. So
yeah. And sleep often will be helped once you put the other measures in place. If
yeah.
you're not drinking so much caffeine, you're not drinking so much alcohol, you're keeping your blood sugars nice and stable throughout the day, you're doing some exercise every day, you're
Mm,
trying to modify the modifiable stressful parts of your life so that you're not up at night thinking about them.
yeah.
Or sleep will follow often. However, poor sleep can sometimes be purely hormonal.
Mm,
Um, uh, Thankfully, there are also things that we can do about that, but lifestyle needs to be in place as well.
yeah. Okay. So we've covered lifestyle. What about treatments then? What about other treatments? What are there any common treatments that people should be aware of? Obviously, the specific to the symptoms. It's not just I guess there's not. A lot of people like to think of that kind of silver pill, don't they? That
Mhm.
will cure everything. But I think what I've realized, I don't know, you're the expert, but what I realized this is that there's a myriad of symptoms, and obviously each symptom, needs to be kind of treated really in some senses, but there's that underlying base of lifestyle. So what about the treatments then? There's obviously not the silver pill that will solve everything. So what about the treatments?
So you can kind of divide them into two sections, really. So hormonal and non-hormonal.
Hmm.
And which one of those we choose, again, depends on the woman, depends on the symptoms. If we start with the non-hormonal ones, first of all, um, so I mean, there's a variety of ones depending on your symptoms. So some people prefer to go down the herbal route. So there are certain herbal preparations that can help.
Yeah.
Not all of them that are available have got a huge evidence base behind them, but one of them is, for example, black cohosh. Has some evidence behind it to say that it can be useful. Anecdotally, I speak to a lot of menopausal women who are trying various different things. I've spoken to a lot of women who found that sage has helped with the hot flushes. There's a lot of things out there, but black cohosh seems to be the one with the most evidence.
Okay.
So herbal first of all, and then if we kind of
Sorry, sister, to interrupt. So I guess as well, it must be just try as well, mustn't it? I mean, because there's the wonderful Google as well, but I guess it's a question of trying to see whether it works for you. So sage, does that help with my hot flushes? Right, let me try and I guess it's tries, and there's not, no one's going to hurt themselves trying a bit of sage, are they? You know what I mean? There's nothing, and from a herbal perspective, I guess I guess it's just understanding, but try and see whether it works for you.
Yeah. Obviously, whenever you're trying anything herbal, just check where you're buying it from, about any interactions with your medications and things. So yeah, it's trying these things, and for some people, they might not do anything at all. But for some people, they might help.
Yeah. Okay. So that was non-hormonal, then hormonal.
Well, sticking on non-hormonal.
Oh,
First
sorry.
of all.
Okay. Okay.
So yeah, then you kind of have to break it down into symptoms, I suppose. So if we start with flushes, there's various prescription medications that can help with hot flushes. For example, I won't go into all of them, but there is an old blood pressure tablet that we don't use for blood pressure anymore called clonidine. That can help with hot flushes for some people, and it can be really beneficial, perhaps especially for people who don't really want to try anything hormonal as well. It's good that there's those options out there. Gabapentin is another medication that can help with hot flushes.
And these may be specific. These names may be specific to the UK, might they? So if we just say there are, let's just say kind of high level, there are medications, aren't there? Let's say that, and consult with your doctor, because obviously, the first thing is to consult with your doctor, but just to let everyone know there are treatments out there, aren't there? That's the point.
Yeah.
Do you know what I
Yeah,
mean?
and it's true that in different countries, we're governed by nice guidelines, or guided by nice guidelines in this country that tell us which medications we feel have got evidence behind them, but other countries may feel differently. So
Yeah.
so yeah.
So check with your doctor, basically, is the advice, isn't it, on that side of things? Yeah.
Yeah. Interestingly, CBT, cognitive behavioral therapy, can help with flushes as well.
Oh, right.
So that's something perhaps a lot of people don't realise. So that's another way of attacking things. Another kind of, well, now this is a hormonal treatment, but perhaps not in the way that you'd think it. So a lot of women are really affected by vaginal dryness, and that can be treated quite effectively by using some localized estrogen cream,
Right.
which really isn't absorbed into the body very much at all. So if you use this estrogen cream for a whole year, it's equivalent to taking one HRT tablet for the whole year.
Right.
So even for people who perhaps are reticent to take any kind of hormone replacement, they're suffering with that particular symptom, then estrogen cream can often be a really good option.
Right. Excellent.
We can go on to hormonal treatments now.
Yeah. Okay.
So
I was trying to jump there, but we need to get through the non-hormonal. Let's go.
So yeah, I suppose hormone replacement therapy is exactly what it says. It's replacing the hormones that you would naturally have classically until the age of about 51. And as we mentioned before, I think in the first podcast, it's estrogen that is the whole point of HRT. It's the
Yeah.
whole point of the menopause. That is why you're getting the symptoms. So it's the fluctuating and declining levels of estrogen as the ovary stops producing it. That causes your symptoms. So if you replace the estrogen, then you are going to get an improvement in your symptoms.
Right.
The important thing about that is that, first of all, estrogen will help the symptoms in the vast majority of cases. Obviously, you know, every case is different, but
Yeah.
so it will improve your symptoms, but also we know that it will reduce your risk of heart disease and it will reduce your risk of osteoporosis as well. So
Okay.
it has two huge health benefits as well. That is especially important in women under the age of 51 who go through the menopause earlier than the average age, because those hormones are protecting you. That's the reason that part of the reason that you've got them. And so if you go through the menopause early, you know, if you're 41 and your periods stop, and you know, therefore, that you're not having very much estrogen going around your body, doing what it should be doing, then will have an increased risk of heart disease and osteoporosis unless you replace that hormone.
Okay.
So HRT under the age of 51 isn't a luxury. It's not something, you know, that you should feel guilty about trying. It is absolutely essential until the average age of the menopause to keep your heart and your bones healthy. After the average age of the menopause, it still has those benefits. So it still reduces your risk of heart disease and osteoporosis, as long as you start it within what we call the window of opportunity. So as long as you start it within 10 years of going through the menopause.
Okay.
Because if you imagine 10 years after the menopause, without that estrogen, your body will have started laying down those fatty deposits on your arteries, which accelerates with a lack of estrogen. So if you wait 10 years and then start HRT, you can't really reverse it with HRT. But if you get in there before those fatty deposits are laying down, then the HRT will slow the deposition of that, so it reduces your risk of heart disease.
Right. And is there have I heard is there any kind of negative for taking HRT? Have I heard is there any negative kind of repercussions of taking HRT that's kind of scientifically proven, or anything out there that people need to be aware of to, you know, balance the benefits versus
Yes. So the first important thing is, if you take estrogen as a tablet, it can increase your risk of blood clots on the legs and the lungs. It can increase your risk of strokes. However, if you have it through the skin, you don't get that increased risk of those things because it's metabolized in a different way.
Right.
So if you have it through the skin, either as a patch or as a gel, you don't get an increased risk of those things. The main thing, obviously, that people talk about in terms of risk and HRT is breast cancer.
Okay.
However, thinking is always changing about that, and people interpret all of the different studies that have been done very differently. However, our UK NICE guidelines, so the guidelines that kind of influence our prescribing and how we manage things, tell us that, based on the available evidence, estrogen has little or no increased risk of breast cancer.
Okay.
So when you look at all the different studies, some studies say it might increase it a bit, some studies say it might decrease it a bit. On balance, we think it doesn't increase your risk of breast cancer.
Okay.
Where the risk of breast cancer does come in is with the other hormone, progesterone.
Okay.
So progesterone is a hormone that, if you have still got your womb, if you haven't had a hysterectomy, then if you're taking estrogen replacement, you have to take progesterone as well.
Okay.
That's not because the progesterone makes you feel any better. It's not for that. It's just because if you were to take estrogen on its own for years on end, it would increase your risk of endometrial cancer because it thickens the lining of the womb.
Okay.
So to counteract that risk, you have to take progesterone. That's the only reason you take it. If you've had a hysterectomy, most people who've had a hysterectomy don't need the progesterone. You just have estrogen. So progesterone, especially perhaps the older forms that we do still use a lot these days, they do increase your risk of breast cancer by a small amount. So depends on which studies you look at, but we think by an extra between 4 to 8 women per 1,000 per 5 years, which is a small increased risk, which actually you can increase your own risk far beyond that by drinking more than the recommended level of alcohol, or not being a healthy weight. So some of us, we might choose to pursue various things in our lifestyle that are actually increasing our own risk of breast cancer more than that form of progesterone does.
Yeah.
But it's a slightly increased risk all the same that some people might not want to have.
Yeah.
And again, that's where it comes to, real preference of the woman and how that makes them feel. The important thing to say is, though, that there are 2 safer forms of progesterone that are more breast safe. So one way that you can have your progesterone is as a Mirena coil. So as a coil that's inserted into the womb and lasts for 5 years, and that gives you the progesterone to protect your womb. We know that for the first 5 years, that doesn't increase your risk of breast cancer. And then there is a form of progesterone it's a micronized kind of progesterone, which is more natural. It's bashed into tiny molecules, so it's more akin to what your body produces. And we know that for the first 5 years, that doesn't increase your risk of breast cancer. So after those 5 years, the risk of breast cancer may increase very slightly, but probably to a smaller degree than those other forms of progesterone. Having said all that as well, if you are under the age of 51, going through the menopause, then none of that really counts, because at that point you're replacing hormones that you would have had naturally anyway. So you don't need to really worry about that increased risk of breast cancer from certain forms of progesterone, because we're just replacing what you should have had. It's really after the age of 51 that it's important to really bear that in mind.
Wow, mind blown. Lots of information. Wonderful as well. Wonderful. Is there anything else, because we're coming towards the end, is there anything else we want to cover on treatments while we're here? Is there anything else we wanted to cover?
I think that's probably most of the information covered. I suppose it's important to say that a lot of GPs, understandably, because
doctors,
doctors, a lot of doctors, we receive our information about what to prescribe from various different official sources, and often information might be outdated, or it might be conflicting with others. It might be difficult to understand, and so and a lot of women have experienced this. I know that when they see their GP, when they see their doctor might be reluctant to prescribe HRT. This can be understandable, because your doctor is coming from absolute best intentions and does not want to increase your risk of anything. Absolute best intentions, but sometimes it's tricky, just because it's difficult to keep up to date with exactly where research is up to. So sometimes it can be difficult being prescribed it, but it's super important. If you're under the age of 51, gone through the menopause, you must have HRT.
Wonderful. Sis, it's been amazing. Thanks so much. Episode 2 is done and dusted. This has been amazing. Thanks so much. Thanks for jumping on board. Once again, DXC friends, you know, you can go to Workplace. There is the Menopause. If you just search for the Menopause group in Workplace, there's lots of support there as well. So please join that. Nicolle, my sis, thanks so much. And we'll talk soon. I'll see you at Mum's house. All right.
Yeah. Yeah. See you later.
Ciao.
Bye.